Namaste, good day. My name is Dr. Kunal Bansal. I am a senior joint and revision joint replacement surgeon at Jehangir Hospital. Today we have the latest in robotic joint replacement, the Mako system with us. Commonly when I talk to my patients, they just don't want pain relief. They want to climb stairs, go for walks, travel and live their life which they were having prior to arthritis of their joints. They want their life back and not just a joint replaced. With the latest Mako system, this helps us to deliver on those expectations, and with its precision, we can match the implant to the patient and predict how the patient naturally moves. That means better function, less chances of revisions in the future. What used to be guesswork is now science-backed, data-driven planning. The Mako robot plans the surgery even before we wheel the patient into the operating room and make sure that the surgery is executed exactly as planned with absolute precision and accuracy. At Jehangir Hospital, we have always striven hard to maintain utmost standards of care and continuing with the legacy. And continuing with our founder's legacy, we have kept it affordable and transparent. Absolutely no surprises, just results, results and results. It's incredibly satisfying to see patients walk out with confidence and say, well, that wasn't as hard as I thought. That's what we work for. Patients commonly ask us, Doctor, what's the future of joint replacement? Our answer is, the future is here. Let's adopt it for betterment of our patients.